Hello, and welcome to my YouTube channel. I am a professor of psychology, and this is your place for all things psychology and more. My expertise is in psychology, neuroscience, and mental health, with over 20 years' experience. I'm from the UK, and I'm a chartered psychologist accredited by the BPS and the APA. I welcome one and all to talk with a professor. This channel is your place for three things: mental health, psychology, neuroscience; financial freedom and wealth, which includes the FIRE movement; and spirituality and lifelong learning. So, today's topic is bipolar disorder. One thing I want to make sure you're aware of, that this is not just mood swings. This is not just feeling happy and sad. And we use these terms like manic and depressed in our everyday language, but sometimes you have to be careful with that language. What does it actually mean? Are you just having a day where you're a little bit off, you're feeling quite good? That's not the same as mania, it's not the same as depression. Bipolar disorder means that you have gross deviations in mood, and the severity makes it a disorder. So these are severe and enduring disturbances in emotionality. You can have an episode or a group of symptoms that are either a depressive episode or a manic episode, and we'll talk about them in a minute. The DSM is what's used to make a diagnosis of bipolar disorder by a psychiatrist. This is developed by the American Psychiatric Association. We're on the 5th edition at the moment. In 2013 it was released, and DSM stands for Diagnostic and Statistical Manual of Mental Disorders. Our diagnosis, as I said, is given by a psychiatrist using the DSM. And what the psychiatrist will generally do is a clinical interview, an observation of the person who's presenting certain symptoms of mania and depression, and he'll use the DSM, this big book, which has a number of mental health conditions, including bipolar disorder, and usually it will list the symptoms that are related to that disorder. It will also have a list of rates at which these disorders occur, and the psychiatrist will use that as well as the observation and the interview with the person displaying the symptoms to make a decision about the mental health condition. Is it bipolar disorder? Is it not? Is it some other disorder? Now, if necessary, psychiatrists may opt for doing further testing, which can include neuropsychological tests, in some rare cases brain imaging, and even a physical health exam, just to rule out a few things, because there can be symptoms of bipolar disorder, but they're related to a physical health condition and not really a mental health condition. For a diagnosis of bipolar disorder according to the DSM, you need to have two classes of symptoms. Now, we can group those symptoms together into two types of episodes. It just means grouping of symptoms: a manic or a hypomanic episode, which is less severe, the hypomanic, and a major depressive episode. Let's tackle the manic and hypomanic first. These are abnormally exaggerated, elated phases where you feel lots of joy, euphoria, ecstasy, and extreme pleasure in everyday activity. Features might include a distinct period of abnormality, persistently elevated mood, or expansive or irritable mood. And this should be lasting around about 1 week. You want to see a significant degree of at least 3 of the following: inflated self-esteem, a decreased need for sleep, excessive talkativeness, racing thoughts, feeling very distracted, not being able to concentrate, increasing goal-directed activity, psychomotor agitation, and excessive involvement in high-risk behaviors. Now, some of what I've said is not too bad. Goal-directed activity, you may have heard of bipolar disorder being associated with creativity, especially in the manic phase of the illness. But the last bits that I've mentioned, taking part in high-risk behaviors, addictive behaviors, that could be very dangerous to the person. The person believes that they're going to jump off a building and nothing will happen to them. That's high risk. They suddenly think, right, I'm going to win the lottery and put all of their money on on a horse somewhere, that again, high risk to the individual. So that's where it becomes very dangerous. But manic and hypomanic symptoms usually go underreported because you don't really report things like, I'm feeling great, I don't need any sleep, I'm meeting all my targets and goals. And it's other people around you that might notice something's a little bit off here. Risky behavior, very expansive mood, elevated self-esteem, and people will notice that. The mood disturbance should be severe enough to cause impairment of normal functioning, or it can require hospitalization. There can be psychotic features, and psychosis just means out of touch with reality. You usually see that in things like schizophrenia, but it can occur in the manic phase of bipolar. The symptoms should not be caused by any physiological effects or any substance abuse, because that certain substances, if they're abused, they can create the symptoms of mania. So no general medical condition, any physical illness or substance abuse should be causing these symptoms. And that's when you get the diagnosis of being in a manic or a hypomanic episode. Next, on the opposite end of this bipolar continuum, a major depressive episode. Most commonly diagnosed is depression. We've all heard of depression, and that's called major depressive disorder. That's the official name according to the DSM. This is a physical, behavioral, and an emotional shutdown. Now, there are a few features, two key ones, might be lasting around about a 2-week period and represent a change from previous functioning. So you want at least one of these two symptoms: depressed mood and a loss of interest or pleasure in activity. Something that they found pleasurable, something that they found interest before, but it isn't there anymore, combined with that depressed mood in certain instances. This might be irritability in children and adolescents, so it might not always be a depressed mood, so that's something to look out for. And the markedly diminished interest in pleasure in most daily activities is something that you really need to kind of keep your eye on. Other symptoms may include significant weight loss when not dieting, weight gain, eating a bit too much, comfort eating and so on, or significant decrease or increase in appetite. You can have insomnia or hypersomnia, so sleeping too much or sleeping too little. Noticeable psychomotor agitation, fatigue, perhaps a loss of energy. Feelings of worthlessness or excessive guilt. And there is a big hit on self-esteem. We know that with regards to having a major depressive disorder, and particularly having a major depressive episode in bipolar, we'll see that self-esteem really take a hit. As I said, it's the opposite end of the continuum to the manic phase of illness, where if you remember, I mentioned an inflated self-worth, and now we're talking about decrease, total decrease, worthlessness, excessive guilt in certain instances as well. A diminished ability to think and concentrate, another symptom. Reoccurrent thoughts of death, suicide, or suicidal ideation. Doesn't always need to be an attempt, it's the idea of suicide. Again, that can be quite worrying, so it's something to watch out for. Clinically significant distress or impairment is something that we're looking for. Is it clinically significant? Because we'll all have highs and lows in life, right? After losing a job, losing a loved one, of course we're going to take it bad, and we will enter a very low mood state. But do we bounce back? And that could be the difference between a clinical case of a major depressive episode or a disorder and just normal functioning, okay? Symptoms should not be due again to any substance abuse, general medical conditions. For example, hypothyroidism can have some of the characteristics of depression, right, with regards to weight gain and weight loss, and also mood fluctuations. So we want to rule out those things. So physical exam might be warranted in those cases. Now, the word bipolar is based on the two very opposite emotional episodes. Bi meaning two polar opposites of emotional episodes, and there lies the problem. We can all feel happy inside from time to time. As I mentioned, happy when you get a job, the birth of a new child, getting married. We can all feel sad at sometimes, the loss of a loved one, losing a job. But it's the exaggerated or gross deviations in mood that cause impairment to our daily lives. and that's what gives you a diagnosis of bipolar disorder. 3 different types of bipolar disorder. Bipolar disorder 1, alternations between a depressive episode and a full manic episode. So this is like a never-ending roller coaster ride of elation, feeling really happy, elated, joyful, to total despair, total darkness. A period of at least 2 months between the manic and depressive episode is considered to be separate. Usually we see an average age of onset about 15 to 18, so early adolescence. Can begin in childhood, and suicide is a very common consequence, almost always occurring after the episode of depression. Imagine this: you're elated, you're feeling great about yourself, lots of goal-directed behavior, and then you crash into despair and depression. That darkness is almost too much to get out for some people, and therefore suicide is a consequence of going into a depression with bipolar disorder. Bipolar disorder type 2, these are alternations between a major depressive episode and hypomania, so hypomanic episode. So no marked impairment in social or occupational functioning here. Average age of onset about 19 to 22, so slightly higher in terms of age, can begin in childhood again, and about 10 to 25% of cases will progress to the full-blown bipolar 1 disorder, where if you remember, we have the full major depressive episode and a manic episode. So this is a lighter version, but many can transition into bipolar disorder 1. And the third type, cyclothymic disorder, this is milder symptoms overall of bipolar. It's alternating between mild depression, so not the major depressive episode, and hypomania, so not the full manic episode. And this can take place for years. This hypomanic and depressive mood states can persist for long periods of time. It must last for at least 2 years, 1 year for children and adolescents. And on average, the onset is very early, it's 12 to 14 years, mostly in females. We see this very early and we see it in females, so we know what to look out for, who's more vulnerable to this. And 1/3 to 1/2 will develop full-blown bipolar type 1. So there you have it, the 3 different types of bipolar disorder, how they're diagnosed using the DSM, and some of the symptoms that are listed. Hopefully that's been useful for you. I will do another video on the treatments and also potential causes. As with any mental health disorder, we don't know the exact causes, but I've spent most of my life trying to research bipolar disorder, so I feel it needs a video. It warrants a video all by itself. We'll talk about the neuroimaging findings that I've looked at and perhaps some of the genetics findings. So we know that there's 80% liability for bipolar disorder. So there is definitely a genetic component, but we know that the brains of bipolar disorder patients are also different to your average person. So we can discuss that in a later video and discuss treatment options as well, whether that be medication. Certain treatment therapies have been useful, but mainly it's medication. We'll discuss that in a later video. So if you found this video helpful, hit that subscribe button, do share with others, and leave a comment. I'd love to hear from you. We're often more capable than we give ourselves credit for, placing mental barriers on what we believe to be our limits. This channel, I try and share with you some insights and understanding, allowing you to be freer, stronger versions of yourself. If you want to break your mental barriers and attempt to be a more fulfilled version of yourself, come and talk with a professor.